welcome to Brainy Medico. In this video, we will talk about the introduction of anatomy and language of anatomy. What is anatomy? It's a branch of biology concerned with the study of structure of organism and their parts. Language of anatomy. It have various positions, planes, and terms in relation to various regions. First of all, we will talk about positions. What is the purpose of learning anatomical positions? The purpose of standard anatomical position is to be clearly talk about the different part of moving organism, no matter how they are moving or what position they are in, to make it easier to avoid confusion when discussing anatomy. Anatomical position. Body assumed to be standing, feet together, arms to the side, head, eye, palm facing forward. Its standard reference position. To ensure the consistency of description, it is very important to keep the anatomical position in mind. Let's learn supine and prone position. Person lying on back, arms by the side, palms facing upward as in diagram, feet together. It is supine position. And prone position. In prone position, person lying on his her face, chest and abdomen. Planes, median or mid-sagittal plane. As you can see in green, it's median or mid-sagittal plane. Plane passing through the center of body, dividing it into two equal right and left half. It is called median or mid-sagittal plane. As you can see in diagram, it is dividing the body into equal right and left halves. Now, coronal plane. Coronal plane is blue in color. It is dividing the body into anterior and posterior half. Plane which divide the body into anterior and posterior half. It's called coronal plane. This in blue is coronal plane and in green is median plane. Transverse plane. It is in pink. Plane which divide the body into upper and lower parts. It is called transverse plane. As you can see, it is dividing the body into upper and lower part. Terms used in relation to trunk. It is also called torso. Anatomical term for central part of human body from which extend the neck and limb. First, ventral or anterior. It is front of trunk. Second is dorsal or posterior, is back of trunk. Medial plane, it is close to median plane. Lateral is away from medial plane. Proximal cranial superior, close to the head of trunk. Distal caudal inferior, close to lower end of trunk. Superficial, close to skin towards surface of body. Deep is away from the skin or away from the surface of body. Terms used in relation to upper limb. Ventral or anterior is front aspect. Dorsal or posterior is back aspect. Posterior. Medial border lies along little finger, median border of forearm and arm. Lateral border follows the thumb, lateral border of forearm and arm. Recall anatomical position here. This is median, this is lateral. This is lateral border. Now proximal. Proximal, it is close to the root of limb. Okay, distal, it is away from root of limb. Palmar, front of palm. Dorsal, it is back of palm. Flexure, it is front of upper limb. Extensor, it is back of upper limb. Okay. Terms used in relation to lower limb. Anterior aspect is front of lower limb. Posterior aspect is back of lower limb. Medial border lies along the big toe. Medial border. Lateral border lies along the little toe. Lateral border. Okay. Flexure is back of lower limb. Extensor is front of lower limb. Proximal is close to the root of limb and distal is away from the root of limb.